Welcome back to Central Valley Talk. We reserve this segment each week to talk about seniors' issues. Are you a senior, or are you taking care of a senior, or are you about to be a senior like me, or maybe I am a senior? But time keeps marching on, and just because there's COVID, just because we can't go out, just because we can't do things, we still have to take care of ourselves and take care of senior issues such as getting our Medicare, getting the Medicare supplements, making sure everything's lined up. So how do we do it during COVID? Right now is the time, if you're on Medicare, right now is the open enrollment time to fill that Medicare gap. I'm not even sure what it all means, but we've asked an expert to come in and help us through it a little bit. Our expert is Diana Morales.
Yes,
Diana Morales.
Hi, Mike.
And you're an expert on this stuff, aren't you?
Yes, senior healthcare specialist.
So when you hit a certain age, like 65?
Yes, 65.
Everybody goes on Medicare.
Right. So if you work 10 years or more and you paid into Medicare, then you automatically get Medicare. And in order to get the Medicare plans that we have available right now, you have to have your Part A and your Part B, which Part A is for hospital, Part B is for the doctors.
Okay.
And so as long as you have those, you qualify.
Okay. And so when you're coming up to being 65, you need to sign up somewhere? How does that work?
Yes. So when your birthday, say your birthday's in March, you have 3 months before your birthday, the month of your birthday, and then 3 months after your birthday to sign up for Medicare and for a Medicare either supplement or a Medicare Advantage plan.
Yeah. And we want to talk about those because it's time right now for those. To
Yes.
get your supplement in, we're going to ask you why it's important, how we sign up for that. But back to the Medicare, like I'm going to be 65 in a couple of years. Do I call you? Do I go to a website and sign? How do I sign up for Medicare?
Okay, so Medicare, there's a 800 number that you can call through Medicare or Social Security.
Okay.
Okay, and so you want to sign up with that first. Then once you're done signing up, then you call me and say your birthday's in March again, say it's March 31st, which is my birthday.
Nice.
And you sign up with me for a Medicare Advantage plan in February.
Okay.
Okay? Your plan will start March 1st. So it's the first day of the month of your birthday month. Okay. Unless you wait till the 3 months after your birthday, then it'll start the following month.
So there's a gap in the insurance, so it doesn't cover everything. So you need a supplement. Do I have that right? Medicare?
Right. So Medicare only pays 80% of your coverage. So for the doctor or the hospital. And if you end up paying, if you're in the hospital for some major surgery or something, it could be $100,000. Right. You're on the hook for $20,000 for 20% of that. So it really it behooves you to take a look at the different plans, either a supplement or a Medicare Advantage plan. Now the supplements have different types of plans in the supplement that cost differently. They can range from $100 to $300
Per month.
per month.
Oh my goodness.
And that doesn't include your prescription drug coverage, okay? So then you have to get that on top of that, okay? But those plans, you can go to any doctor that you want. Now, if you get a Medicare Advantage plan, that's more like an HMO plan, and most or a lot of those plans is zero cost to you, zero to go to the doctor. They include your prescription drug coverage at a zero cost to you. They also, a lot of them include dental, vision, hearing, gym membership, chiropractor, acupuncture, also transportation, which, people don't realize transportation for people who are elderly and are afraid to drive or afraid to go on the freeway, or just because gas is expensive right now. A lot of the plans include transportation at a zero cost to you, and some of them are unlimited mileage. So if you live in Madera and you have a doctor's appointment in Fresno, they'll go pick you up, bring you to Fresno for your doctor's appointment, and take you back. Now, it's almost like having a limo service at your service to pick you up. And if you have family members that can't take off work to take you to your doctor's appointments or those sort of things, or the dentist appointment or for your eyeglasses, because it takes time, and sometimes you're there a few hours.
Now, this is all new to me, so I'm kind of unraveling it live on TV here. But
Yeah.
so you've been on Medicare a couple of years, and every year there's a period, what they call open enrollment.
Okay, so right now we're in annual enrollment period, okay?
Enrollment period. And you only have a couple of weeks to do this, right?
Correct. So you have from October 15th till December 7th.
Okay.
So once December 7th is over, you have to wait to
Whole
do
nother year.
a whole nother year to do the annual enrollment. Now there are special enrollment periods too. Open enrollment, what you were talking about, is from January 1st to March 31st, and that is say if somebody signed up and they're like, gosh, I just don't like this insurance, I want to change back. They can change from a Medicare Advantage plan to a different Medicare Advantage plan, or go back to original Medicare. Okay.
Now, so right now is an enrollment period that ends on December 7th.
Yes.
And you have this period to sort through some options. Now, I'm not an expert on insurance. In fact, I know nothing about it at all, except that I have it and I've never used it. But you are an expert. You could take somebody through these different plans and help
Right.
them figure out what's best for them.
Right. So I'm contracted with almost all the plans that are here available in our area, and I'm a local agent, because a lot of times you see these companies who are advertising right now, like you see Joe Namath advertising for Medicare Advantage plans. You're going to get somebody who's not local, who lives out of state, who doesn't know the doctors, who doesn't know, the hospitals. You're not going to have a one-on-one. You're not going to have a relationship with that agent. I have relationships with my clients where they will call me, hey, Diana, I need an appointment with my doctor. I can't get in. Can you help me? I will call the doctors. I'll, go over and above. I'll do a 3-way call with them. So it's that little extra bit of helping your clients that they feel that they're getting, the extra help that they need.
So for this extra help, I know the answer because I asked her before we went on the air and I was shocked. It's free to call you, right?
Oh, yes.
You get this advice for free.
Yes.
And also, you told me you were here a couple weeks ago, you can get them into their Medicare Advantage plan. I don't know if we use the word free or at no cost to them.
Zero cost.
Zero cost. So,
Zero cost at month. A lot of them are. There are some that cost, but for the most part, most of the Medicare Advantage plans are zero premium. So monthly cost is zero. To see the doctor, zero.
Okay.
Specialists, some of them are about $10. But it just depends.
Yeah.
On which plan. So you have to I have to meet with them either by phone because of the pandemic. I can send them a quote, via email, or we can meet face to face with a mask on,
Yeah.
6 feet apart, and I can go over specifically what plan will best suit them, because everybody's different. Everybody has different, illnesses or prescriptions or doctors that they prefer to go to.
And they may have, I want this doctor, this doctor, this doctor. You'll find one of them, hopefully, in one of the plans.
Right. Well, or hopefully I'll find all their doctors in the same plan, and so that they can keep those doctors if they really want to keep them.
Okay. Now, if I'm understanding this right, every single person that is on Medicare should be making some choices right now.
Yes, because a lot of the plans are changing for next year. A lot of the prescription drug plans are changing. There are some, medical providers that are no longer going to be contracted
Right.
with some of the.
Each year they add, it's by contract. So I
Right.
had my dentist on my insurance last year. This year, they're not on the
Right.
plan. They change. They don't really tell you that much about it. But they probably do.
No, but then you make an appointment and you're like, oh, I can't go to my dentist
Right.
now, or I can't go to my doctor now.
But now's the time to find out. Just review the plan.
Right.
It's free to review.
It's free to review.
Now, if you don't make a choice, does your last one just automatically flip
Yes.
over?
So it just rolls over to the one that you
But
have.
you should look at it. I mean,
You should at least look at it.
or let Diana help you look at it. I
Right.
just read through all that. It's so confusing for me. I like to bring in a professional. You do it every day. You know all this terminology, HMO,
Right.
PPO. I don't know what all those are.
Right. And so you really need somebody to help you with it, because, unless you're going to read the Medicare, Medicare booklet, which is like this thick, and read it from beginning to the end, which I have read, from beginning to end, that book. And we take tests every year as agents. We have to test for this stuff. We have to test with all the different insurance companies. We have to test with the state of California. So we have to be prepared and knowledgeable so that we can help our clients with the different plans that are available. And so it really, really, I can't emphasize enough for them to call for the free, it's free to them.
It's free to find out, right?
Yeah.
Now, don't wait till December 7th because Diana's going to be busy
I'm
that
busy.
day.
I'm busy already. I've had
Busy
clients
already, I
calling
can
me right
imagine.
now.
It's
Yeah.
gotta be, this has to affect tens of thousands of people right here in Fresno
Right.
alone.
Right.
It should be checking their plans and making sure they're covered. And,
Right.
you hate to get sick and go to the doctor and now you find out, oh, you're not covered and it's going to be, a lot of money or something like that. So.
Right. And you don't want to be, having to pay out thousands of dollars later, or finding out that, oh, I could have got this other plan and it would have cost me zero.
Yeah. Now, how do they reach you? Where should they start? Is there a website, or you want them to call you up direct?
They can call me directly. My number is 559-721-2311, and that goes directly to the office, and then it gets redirected to my cell phone if I'm not there at the office, which right now I'm in a lot of, appointments. But if I don't answer, leave a message. I'll call you right back. I always call my clients within, 24 hours or within the same day.
Okay. Now, you started to tell me a little bit about maybe some of the information now we'll be able to see on our phone. You'll send us something and we can look on our phone and...
Yes. So because of the pandemic this year, a lot of the insurance companies and carriers went digital. So we can send the information either on your cell phone or via email, like I said. And so it really is helpful if they really don't want somebody coming over to because I'll come to their home even to meet with clients in home appointments, or like I said, or they can come to the office and meet with me.
Yeah. Well, there you have it. So much clearer now. Thank you.
You're welcome.
One thing you made clear is I don't want to read through all that information. I don't understand that well.
Yeah.
I want to use a professional to figure it out for me and to advise me and help guide me in the right direction. And
Right.
I think Diana Morales is the person to do that. And the way you get a hold of her, give your phone number one more time.
559-721-2311, or our office is there at 770 East Shaw, Suite 104. We're right across the street from the Cheesecake Factory, the Fashion Fair Mall.
Nice.
We're on the opposite side. We're behind Wells Fargo. We're right there, and it's a 3-story building.
Yeah,
that
so
we're
you go
in.
to her office, she could come to your home, or if you want a COVID-safe environment, she'll figure
Right.
that out for you too.
We try to make it as easy as possible for you. So
Any last thoughts for our viewers?
Call right now because time's running out. December 7th, is here before you know it. Christmas is right around the corner.
Yeah.
We're already almost in November.
Right through Thanksgiving, we're going to lose a few days before
Yes.
that. So
Yeah,
don't mess
yeah.
around. All right.
Right,
We will be back.
exactly.
I can't say enough. Call Diana Morales. If you're on Medicare, it's now the time. You got to make some choices
Yeah.
and make the right one.
And I do speak Spanish
Okay,
too.
good,
So
good,
if I have Spanish-speaking clients, which we do here in the Valley, it's very helpful to them. We have paperwork in Spanish, and then I can speak to them in Spanish and help them with
Right.
that.
Call me here at Central Valley Talk. If you didn't write down Diana's number or you have some questions, I'll give you her direct phone number. So
Yeah.
we'll get you taken care of.
Thanks,
We'll be
Mike.
back with more Central Valley Talk right after this.